everyone, it's Dr. Sue Cancer Vet. Thanks so much for watching. This video, I am going to answer some of your questions that you asked me about steroids and cancers. So I put some questions out on social media asking what were your questions about steroids. So Gil asked, why does prednisone decrease the efficacy of lymphoma? So we talked about that. It causes this thing called multi-drug resistance. So basically it puts a pump in the cell membrane of lymphoma cells that allows the cancer cells to pump the chemotherapy outside the cell so it doesn't get killed by the chemotherapy. So again, just as a review, we talked about we don't know how long the pet has to be on steroids before that effect is seen, but usually it's thought to be about 1 to 2 weeks, probably 2 weeks. So don't get too worried if your pet's been on steroids for a week or two, but you know, I've had some patients come in on a month or two. I do get worried. The other part of Gil's question was, why do we use steroids in the CHOP chemotherapy? So it's not just the CHOP chemotherapy that we use steroids. As I mentioned, Pokey it was on COP for a while. It's included in that protocol as well. So a lot of these protocols, because prednisone has an anti-cancer effect, it was included in the protocol. The idea is if they're getting chemotherapy, they don't need usually to stay on chemotherapy. So the CHOP, which is also the University of Wisconsin-Madison protocol, they're usually on chemotherapy, tapering over the first 4 weeks, and then they can come off the steroids. So the benefit of getting chemotherapy is your dog doesn't need to stay on steroids. The other benefit, if you watch the other lymphoma videos, is that they have much higher remission rates, so higher rates of going into remission. They stay in remission longer and they live longer if they get chemotherapy combined with their steroids. This resistance with chemotherapy has only been seen in dogs, so I don't worry about that in cats. So if you have a cat that was diagnosed, say, with high-grade lymphoma of the intestinal tract, all your diagnostics have been collected, you've had your ultrasound, you've had your surgery, your biopsy's been done, and you're not going to see me for a week, and your vet calls me, I'll say, go ahead and start the prednisolone, which leads me to the next part of my question. Why do we use the version of prednisolone instead of prednisone in cats? And so that is the active form of pred. What do I mean by that? So a dog will take in prednisone and the body converts it to prednisolone, which is the active form in the body. Not all cats can convert pred to prednisolone, so we don't know which cats can, so I prescribe prednisolone for all kitty cats. Not every doctor does, not every internist does, but I do. So if you're seeing me and you're a kitty cat, you're going to be going home with prednisolone. So that is the active form of pred. All right, so Michelle asked a great question. And Michelle, unfortunately, that study has not been done yet for cats with lymphoma. And actually, usually cats for lymphoma, they stay on their prednisolone longer. So at this point, I'm still keeping cats on their steroids until we have evidence that they will do just as well without their steroids as the study with dogs. One of my colleagues was talking about a paper, and this was actually a couple years ago, but still worth mentioning because it's good information for oncologists. So they looked at dogs that got the multi-agent chemotherapy CHOP protocol, so lymphoma dogs with and without pred, and actually the dogs that didn't get pred didn't do any worse. So that's great. So it was always thought that the prednisone was really, really important for remission rates and survival times. So this study showed that it was okay not to get prednisone. My colleague, Dr. Tham, who is at Colorado State, which is a great cancer center in the U.S., he still includes prednisone, that 4-week taper like they mentioned, and I do as well, because, again, it gets dogs eating, they feel well, it does get their lymph nodes, their lymphoma responding. But the take-home message for me is if the high doses of prednisone, some dogs are just more sensitive than others. You know, if the owner calls me, they're like, oh my God, they're panting, they're peeing, they're having accidents, it's just driving me crazy. I'm going to taper them without hesitation more easily than I did before this paper came out in 2015. One of the other side effects that I didn't mention is some dogs really get muscle wasting. And if you've ever not worked out for a while, you know how really frustrating it is, because you can lose muscle really easy, but it can be hard to get that muscle mass back on. If I have a diabetic, I used to be like, oh, I hate to not put pred in. It's so important for the protocol. Now I'm like, they're a diabetic. I don't want to mess up their diabetes. I'm happy to not put the pred in the protocol. So Tina asked some great questions about using steroids for mast cell tumor, and yeah, as I mentioned, we do recommend, it's often part of the protocol with chemotherapy, so we often use it with a drug called vinblastine for dogs with mast cell tumor. So we talked about the side effects, that was one of her questions, so I think we covered that, and talked about what to do if your pet's not eating. So the steroids will often improve the appetite, but again, watch the other vlogs that we talked about, 68, 69, about what to do if your pet won't eat, the different medications. Think about Serenia and Entice as well will often be helpful. With mast cell tumors, often they will have increased histamine, which can cause increased acid in the stomach, so sometimes an antacid will be helpful as well, so you can talk to your veterinarian about that. And Michelle, I have a couple of videos about mast cell tumors that we'll put the links as well, so that might be helpful if you're looking for more information. But prednisone also does have an anti-cancer effect for mast cell tumors as well. The tripods community wants to know about using steroids for bone cancer patients that have metastasis, which I'm guessing to the lungs, because that's the most common place that bone cancer spreads. Would there be any benefit to using prednisone there? So, really important thing. So we want to make sure again that our any patients that we're considering steroids are not on a non-steroidal anti-inflammatory, because as I mentioned, that's a no-no. But it's a good question because it circles back to what about the other cancers, just all the other cancers out there where steroids don't have an anti-cancer effect? What is the role that we have for steroids? And so, because steroids have been used for years for lots of different cancers, and you have to remember that cancers, as they're growing in a tissue or in the bone, so it can create inflammation. And so usually steroids were used and people thought the tumors were getting smaller, but it was really just that anti-inflammatory effect. And they don't have as good as a anti-pain effect, or what's called analgesic effect, as non-steroidal anti-inflammatories. So in general, I don't use steroids unless they have, if I'm looking for something as an anti-inflammatory, really for its anti-inflammatory effect and its pain effect, I'm usually going to pick a non-steroidal anti-inflammatory, unless there's other reason that it has an anti-cancer effect, like lymphomas, the leukemias, some of the other cancers that we talked about. So going back to the tripods question, would there be benefit to using steroids for a dog with metastasis, end-stage metastasis to the lungs? Maybe if they're coughing, and you're just looking for an anti-inflammatory effect. But again, I'd have to go over the case and, really figure out, do we want to use a non-steroidal anti-inflammatory versus a steroid like prednisone, because they're, to my knowledge, not a anti-cancer effect the way that some of the other cancers that we talked about. Finally, I've gotten some questions about what dose do we use, and so there's a very wide range of dosages used for steroids out there. The low dose, which would be physiologic dose, where you're just trying to replace like what the adrenal glands would be making. As you get higher, you get to anti-inflammatory doses, and then the higher doses, you get to immunosuppressive doses. So there is a range of doses out there. Some dogs, as I mentioned, will have side effects. Two same-sized dogs, you can put them on the same doses of prednisone, and some of them will have side effects and some of them will not. So we have to treat everyone as an individual. Good news for cats is they tend to be much more tolerant to prednisone, so they tend to have less side effects. It tends to be easier to taper them off of it, and they just tend to handle their steroids much better. And that's one of the reasons that we tend to be able to keep them on their steroids longer during their chemotherapy protocol. So that's it, guys. That was 101 for steroids in dogs and cats and cancer. I hope I answered most of your questions. We could probably talk all day, but I really hope that I answered them. If I didn't, leave your comments below. Don't forget to subscribe, share. I hope you're enjoying these videos, and I'll see you at the next one.